Hello, and welcome back to another episode of Straight Up with Steph. Today's episode I'm really excited about it. This is something that I've been planning to do for a while. And I actually talked to this guest quite a while ago, but this is a sensitive subject, and she requested that we keep things as anonymous and confidential as possible just because of her history where she worked. So today we're talking about military dentistry. And this is something that has been brought up lately because of specifically the oral preventive assistant that some states are wanting to pursue to help relieve the burden of the hygiene shortage. But this oral preventive assistant, by the way, if you don't know what that is or you haven't heard of it, I will put the link to a podcast episode down in the show notes that I've done previously. Please make sure that you know what this is because I think this is something that is going to come up a lot in the coming years. But the oral preventive assistant position is based off a position in the military called the Prophy Tech. And I don't know if it's just me being ignorant over the years, but I did not know that this existed, but I do now. So that's good. But I wanted to learn what the Prophy Tech is and honestly just how dentistry works in the military. The only experience I had working in the military was a rotation that I did back in hygiene school, but I don't really know the day to day or the structure or how these different positions are. So, if we're having a new clinical position created, like the oral preventive assistant that's based off the Prophy Tech, I wanted to know what the Prophy Tech is. And my guest today, she has had experience working in the military setting, but she preferred to keep herself anonymous just because this is a sensitive subject. We talked today as far as what the Prophy Tech is, what the training looks like. So today we talked about the different clinical positions in the military and how they differ from what we would see in private practice. And it is quite different whether we're talking about a dentist, a dental hygienist, a dental assistant, or the Prophy Tech position. Just like anything else, there's pros and cons to working in the military, working in the civilian world, and having a clinical position like the Prophy Tech. We also talked about the limitations and advantages of being a hygienist in the military, and also why someone would choose to work in that setting. And of course, we talked about benefits and earning potential and pay and all of that. It was a really fun conversation today, and I have a lot of respect for this guest because it's not easy to get on a platform like this and talk about something so sensitive. So I just really appreciate her time, and I appreciate you, as always, for listening to this podcast. And remember, with my episodes, I always have it separated into chapters. I know these are longer episodes. If you want to just jump to one section, just check out the chapters so you can listen to whatever you want to. I hope you enjoyed today's conversation about dentistry in the military. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, happy Sunday. Thank you so much for joining on the weekend. How's your weekend going?
It's going pretty lovely. Lots of fun stuff over the weekend, and I'm excited to be here today.
Yeah, me too. No, I'm so stoked. So I've been looking forward to this conversation. I know we talked quite a while ago, and I'm just really glad that you decided to come on. So I guess first off, I know that you have history in different dental settings, but what made you pick a military dental setting?
Just being military affiliated, I have a husband who's in the military, so I've got lots of friends in the military, and then also my first training for dental was through the military for spouses, for active duty members. So that had me sold when I did the program for dental assisting a number of years ago through the Red Cross.
And why, like, what sold you on it? Was it just the experience or just your like relationship with the military?
My relationship primarily. I mean,
Okay.
the experience was also really good. There's a lot of things that I like about having had worked in a military clinic. Lots of good things about it, but serving members of the military is a big one for me.
Oh, yeah. I remember back in school, we did one of our rotations at a military clinic. This was up in Alaska, and I actually found my board patient through there, but we got really good experience working in that setting. It was pretty
Yeah,
cool.
that's awesome. Yeah, there's plenty of people that have looked at being in that setting and then thought, oh man, you would have made a good board patient. I've
Oh,
told people
yeah.
that a couple of times actually while I'm working. I'm like, oh, too bad.
Well, and I still remember this guy too, because, it's your biggest nightmare when you're in school to have your board patient not show up, which actually did happen to some of my classmates. But this guy was like solid. I'm like, I don't have to worry about him. He's going to be there.
That's amazing. I had one cancel on me, I think, a week before boards. And then unfortunately, one of my friends let me share their board patient. So
Oh, thank
it ended
God.
up working out
Yeah.
okay. Yeah, but I was
Oh,
freaking
good.
out.
Yeah, it's like stressful enough. You don't want to worry about that. So that was my only experience in a military setting. So I guess how does it differ? Like, how does the military setting differ from like a regular private practice?
Okay, so the military setting is going to be different in the biggest way, and it's going to be why you have a push to take care of patients the way that you do. So, of course, in private practice, the predominant factor is going to be caring for patients, and then the secondary thing is going to be profit, of course, and keeping your business running.
Yeah.
So, there's a lot of stuff that has to do with money in the military and patient care, but their predominant push is going to be keeping their patients, which are soldiers, deployable or what's called in the military in readiness. So that just means that they need to be healthy enough to be able to deploy at any moment to fulfill their duties as a service member.
So I remember, I don't, especially when I was in Alaska, I guess we saw a lot more military people than I do here in Colorado. But I
Hmm.
remember they would come in if they were about to be deployed with like this form or checklist or something to make
Hmm.
sure that they were okay. Is that what you mean when you say battle ready? Like they don't have
Yes.
abscesses or any huge infections?
Correct. So they have different classifications on what their readiness standards are. So in order for them to be deployable, they have to be what's called a class one or a class two. So class one or class two class one is going to mean that they don't need any dental work at all. And then
Okay.
class two is going to be they need some dental work done, but it's not something that they're expecting to be emergent within the next year. And then class three or class four means they got some stuff going on that's going to cause a painful emergency within the foreseeable future.
What can you just give us some examples of what would be in class 2 and then what would be in class 3?
Class two is going to be somebody who needs to be on a perio maintenance schedule, maybe,
Okay.
or needs a cleaning, or maybe needs an occlusal filling, but they think that that's something that could possibly wait and won't be emergent. And then when you get to class three or class three is going to be like, oh, they need a pull or they need endo or they have a really big cavity that's going to turn into endo. And then class four means they're probably already in pain or they have lack of function. So they're going to have a dental emergency as well, basically, is what it means.
You mentioned perio maintenance is
Hmm.
class 2. What about like if someone needs SRP, if they've got active perio? I'm just curious how the
That would still
military
be
sees that.
that would still be considered class two.
Okay. Okay.
Yeah.
Yeah, because as much as it pains me to say it, like I want people to get their SRP done ASAP, but
Yes.
honestly, it's probably not going to blow up like a endo would.
Hmm. Hmm.
Yeah.
That's how they see it, definitely. Yeah. But I'm on the same side as you, like, dang, they really need this SRP and they're sending them to wherever, Kingdom Come.
I know. It's like you
Yeah.
have to get this done, but honestly, technically, yeah, it probably could wait, depending on the patient. There's some that
Hmm.
where it's severe and it does need to get done right
Yes.
away. So I'm curious as far as scheduling and what does the day of a dental hygienist look like when he or she is practicing in the military?
Okay, so while working in a military clinic when I was there, I had a really good schedule to be able to practice hygiene in a really effective manner because my schedule was not overloaded. But that took a lot of advocating for myself as a provider to keep my schedule the way that it is blocked. So, for example, when I was working there, I would have 7 patients a day. Okay, if they were
Mhm.
Prophy or 43, 46. So I would have adequate amount of time to really provide thorough patient care, really good OHI, have a personable relationship with the patients, and just do a good job and figure things out for the patient so they walked away with good patient education and good service from my end in all aspects.
So what like you would have basically an hour per patient or what if
Yes.
you
And
needed longer? What did
if
you have that autonomy to add time?
Yeah, okay, so hour per patient for Prophy 43, 46, and then a double block for anybody who needed SRP.
Oh,
So,
that's nice.
yeah, it was really good. It was really good. It was one of my favorite things about working in a military setting. And then even if I had a 4346 and I couldn't finish everything, like, we got a recare appointment, based upon availability in 6 weeks for them to have a prophy. And if I couldn't complete the 4346 or diagnostics needed to be changed or anything like that, if I needed an additional appointment to create or to complete 4346, I could bring them back for an additional appointment or go grab a doctor and be like, hey, this is what I see. This is what happened during diagnostics. Let's go ahead and change this. So the conversation was open about patient care, and I had a good amount of time to work on patients in an adequate way, I think.
That just really makes me feel good because sometimes I just wonder if I just because I guess I don't have experience working in the military, like is the quality of care the same? You know what I mean? Or is it more, I don't know, rushed or whatever? But that makes me feel good that you say that.
It's complex for sure. So, from the hygiene side, I do think you can provide pretty adequate care based on the autonomy of being able to make adjustments to the schedule and to be able to have open communication with the dentists that are on your staff. So, that was a huge plus for me when I was working there.
Back when you were working there, like, did you have a good relationship with the docs that were there too, the dentists?
I try to always foster a good relationship with
Yeah.
everybody, but there is a turnover in the military that's frequent. The only thing that you can expect from the military is that things are going to change at any given
Yeah.
moment. So
Yeah.
you only have a short amount of time, I think, generally speaking, to work with these doctors. But one of my favorite things was to be able to build relationship with them to calibrate to get the patients the best care possible.
Yeah, and I love those relationships. I've been so lucky in the past to have great relationship with dentists, and I mean
Hmm.
I've had not so great ones too, but I feel like there's so much like negativity right now, especially with dentists and hygienists and a lot of friction, and I'm like, man, if we can figure this out and work together, like it works so much better for both of us and for the patient, and it is possible.
Yes, in that setting, I had very few doctors that I had worked with personally where I just looked at them and was like, "You're a lost cause, my friend." Like that really didn't happen. There were a couple of people over the years that I had butted heads with, but also I just came to a conclusion. This is the way they work. This is the way I work. This is always going to change. I'm going to go ahead and keep going. So I've had both
And
ends of the spectrum, but for the most part, I've worked with amazing doctors who are open and willing to learn.
that's awesome. You mentioned high turnover. I think you were just talking about dentists, but is that the same for hygienists or maybe even assistants too in the military?
Absolutely, because they're military affiliated people for the most part. And it's
And
not
for those who don't
because
know, what does that mean when
I
you say
mean,
military affiliated?
well, they're normally military spouses that come into the dental clinics. So they're
Okay,
going to leave with their significant others when they are assigned to another duty station. So
gotcha.
there's a few people who work there that, no longer have active duty people that they have to follow, and they have been in the clinic for a number of years, or their spouses have retired in a certain place, and then they end up being there for the long term after their significant others get out of the military, or people who were prior service or even in the reserves who work inside the dental military clinic too.
Okay, interesting. So they could be there for, I don't know, a year or two, or they could be there for a long time. It just depends.
Yes.
Yeah, I guess like with anything else. But
Mhm.
that's actually a really good segue into probably what a lot of people want to learn about, which is Prophy Techs and
Yes.
how maybe not dental educated people, maybe spouses, are coming in and being trained in the dental setting. So can you explain like how that has worked from what you've seen?
How their role has worked in the clinic?
Like, how does someone come in to the clinic and I guess get trained when they haven't had prior dental
Oh,
education? And what are they
okay,
allowed to
okay.
do?
So, as far as Prophy Techs are concerned, going into the military setting, they pick their job. They're going to work for dental, as long as they're not coming in as a doctor, because you can come in two ways into dental when it comes to the military. You can, aside from the people who are not military affiliated, you have the soldiers that join the military who are going to work for the dental clinic. They go take their basic training, of course, that has to do with their job as a soldier. And then they go through training, which is called AIT, which is the training that is related to the specific job that they're going to do. So I learned that when soldiers come in and they join the Army to work for the dental clinics, they go to AIT to be a dental assistant first. So the AIT training to become a dental assistant is 8 weeks long. And the majority of that training, or I'm going to say almost all of that training, is going to be didactic. So it's going to be book work.
Okay.
Yeah, so it's going to be heavy book work and then little to no clinical experience. And
And
then
what is the scope, I guess, of a dental assistant in the military? What are they allowed to do?
same things that they would be allowed to do in private practice setting. So assisting the doctor, but it's kind of broken up a little bit more for different areas of the clinic so that they can make sure that they have people in certain spaces. So they have people who will work more in sterilization because it's a big clinic and they need people who are dedicated to just doing sterilization. Or they will be assigned to an area to basically where they relieve the civilian staff that are working with the military dentist because they were on a clock. Like, you can only work 40 hours a week in a military clinic if you're civilian staff. You cannot go past 40 hours. It's unacceptable. They're never going to let you do it. So they come in as a support system. So they have all of their responsibilities as a soldier, first and foremost, and then they come in as a support system to the clinic to help fill the gap where needed, where the dentists need help at.
Okay. And back to their training, you specified it's mostly book work. Like they're not necessarily
Yes,
working on live patients in their training.
they are not. Initially, when they join the military, no, they are not. So they learn their skill set in the clinic setting.
Do
So
you, does
go ahead.
it, do they, does that freak them out? I feel like that would freak me
Yes,
out if I hadn't.
absolutely.
Okay.
Absolutely. Whenever the clinic would get new soldiers, they would throw them in there. And I don't think a lot of the people who worked civilian side when we got a new soldier realized that they didn't have any training clinically because they would
Mm,
get really frustrated and be like, oh, this soldier doesn't know how to do anything.
yeah.
And, in order to keep good communication and open communication, when I was there, I started asking questions. So I would talk to the new soldiers coming in. They're young, they're young soldiers coming in. They just got thrown into a dental clinic. And to me, after a while, it started getting really obvious. Initially, I was just in my bubble working hygiene. And then, I'd be done with the patient. It'd be time for lunchtime. And I would have some assistants still working with doctors. So I would go look for a soldier, be like, hey, this person needs assistance. Can you go relieve them for lunch? Or can you go relieve them for this or that? And they'd be like, I'm going to send this person because that makes me nervous. So I started
Mm.
going, why are they nervous? Why?
And then you
What's
learned
Yes,
like,
and then I learned. I was like, oh, they didn't have any clinical experience. They gave them a book, told them this is how it goes, and then they threw him out into the dental chair and be like, hurry up and finish up with this doctor so that everybody else can get out of here.
oh
So
my
that was really
gosh.
interesting.
Yeah.
Yeah.
I still remember, and I went to hygiene school a long time ago, and putting my hands in someone's mouth. Because when I went into hygiene school, I was not an assistant first. So I had no
Yes.
experience.
Yes.
And putting my hands in someone's mouth for the first time was like the weirdest thing ever. So, and I was in school, I can't imagine going to an actual job and having your first experience be there?
Right. Yeah, I definitely saw that with some of the people from my class in hygiene school. I remember one of the instructors grabbing an instrument over the person's hand and putting the scaler subgingivally because they just would not do it. So it's scary. It can be really scary.
Yeah,
Um,
it is. And even in school, you're in a protected environment, and it's super
yes.
supportive, but even there, it's scary. So I can't imagine in an actual clinic where you've got an actual real life patient in front of you.
Okay, so
So
we were
who's training the dental assistants?
actually, I had not asked that question by the time I had left there. So
Oh,
I'm
okay.
I'm guessing it's going to be other dental assistants. That would be
Okay.
my best guess. And then of course they have to have a doctor on staff to help, like how similar to how we had in hygiene school when, we would have our hygiene instructors there, and then we would have doctors that ran with the clinic for treatment planning and stuff like that. So
Yeah, okay,
that's my
makes
best
sense.
guess. Yeah, because they're going to be training, they're doing heavy didactic, but they have to be attached to a clinical place.
Hmm. Okay. And is there any test or anything that they have to like pass, or are they pretty
I'm
much
sure.
just read the book and go
No,
start working on
I'm
people?
sure that there's going to be some kind of assessment that they have to pass. That's the way that the military is going to work. So
Okay.
they train, assess, and then they send them to where they're going to be. So,
Okay. So moving toward the Prophy Tech, and I'm really curious about this just because of everything that's going on right now with, different models being proposed. And some of these models, like the Oral Preventive Assistant, is being modeled after the Prophy Tech. And that just
yeah.
made me really curious. I'm like, okay, what is a Prophy Tech? How does that work? So what is that?
Okay, so the soldiers will go in to dental, become a dental assistant. They have a certain amount of time that they have to work as a dental assistant. And then to help fill the need for patient care, they established the role of what's called X2 in the military world. So X2 equals Prophy Tech.
Okay.
And they go to an additional amount of training to be able to work in patient care, providing hygiene. So when I was working there, I found out that the soldiers would go to X2 school, and X2 school is approximately 8 to 10 weeks, and the same heavy didactic training is applied when it comes to hygiene. And then they have about 2 weeks of clinical experience working on patients before they are sent back to the clinic to work as a Prophy Tech with the same kind of patient load that a hygienist has.
Okay. And what can you, I guess, define as far as the scope of an X2? What are they allowed to do?
They are supposed to be allowed to do very simple prophylactic cleaning. So, a prophy
Yeah.
on a quote unquote healthy patient with minimal to no medical complications. They're not allowed to work on implants, and that's what the scope is supposed to be. So
Okay.
simple, the easiest, most beautiful mouths are to go to the quote unquote Prophy Tech.
And who's deciding if it's a healthy mouth or not?
It's going to be a dentist. So
Okay.
they have an exam, an annual exam, and the exam is going to be one of the most important of the readiness that we were talking about for the soldiers earlier. Okay, because if they don't have that exam, that automatically makes them a class 4. Okay, so the class 4, remember I
Oh.
told you, means somebody is not deployable. And the reason
Hmm.
why it makes them a class 4 is because they don't know what kind of dental work they need at that time.
Yeah.
So they have a really heavy schedule for the dentist and a push for those dentists to do those exams and run those patients through just to absolutely make sure they're not quote unquote red on MedPros is what it's called. So they have a green light, a yellow light, and a red light basically to explain it to the soldiers and be like, hey, you're red, you haven't had an exam, or you're red, you need a root canal, or you're red, you need whatever procedure, so you are not deployable, so you're going to be in trouble. So the dentists do the exam, they establish, of course, they do the diagnostics, and they put in the codes for the type of cleaning that the patient is supposed to have. And then they book an appointment later on for that patient to see a hygienist or an X2 slash Prophy Tech. So the dentists are establishing what their needs for care are.
Okay. So they're probing and looking at the x-rays and deciding what's up.
They're doing PSRs.
Okay.
Yeah. So they're
So,
doing
okay.
PSRs, but it's not full mouth probing during exam because of the number of patients that they're seeing. They don't have time for it.
Okay. And I do want to circle back to dentists and
Hmm.
like how their, I don't know, day goes or whatever it is.
Hmm.
But you mentioned just a few minutes ago that the X2s or the Prophy Techs are supposed to be working just on pretty much pristine, healthy mouths, right? So, in your
Yeah.
experience, have you seen that not be the case?
Yes, many times. And so, kind of circling back to the dentist schedule, how I told you the motivation to keep the dental clinic going and to be in good standing is to have patients ready to deploy. They want the exams done and they want
Okay.
them done yesterday. And the soldiers have a responsibility to that. So when you see the dentist scheduling, They have full days where they're doing nothing but exams.
Mm.
But a lot of times, the number of exams that they do is going to be really high. So it allows less time for them to do proper diagnostics. So I'll give you an
And what's
example.
what's
Go ahead.
really high? Like how
Okay,
many exams are we talking about?
okay, so from 7:50 in the morning to 10:50, the dentist will have 3 columns of exams, and those exams are 20 minutes each, quote
Okay.
unquote. So at 7:50, the dentist has 3 exams that they need to do within 20 minutes. And
Oh
that's
my
all the way
gosh.
from 7:50 to 10:50 every 20 minutes.
Holy cow.
On,
Okay.
on
That's a
top of
lot.
that, they might have somebody who's coming back from an SRP who needs a perio re-eval. So they'll stick a perio re-eval in there. Or somebody who needs an eval for OS or endo, and they haven't had the diagnostics yet because they have come in on what's called a sick call. So basically, like an emergency.
Okay.
So they have those 3 columns of exams, and like, oh, we have another patient that you need to see because they need to be in readiness. So here's another patient. Make sure that they don't need endo.
Holy cow.
Hmm.
I don't even see how that's physically possible.
It was
That's a
insane.
lot.
Yeah,
And
it was
I mean,
much.
how are the dentists doing? Like, are they okay? Are they burnt out? Like, what's going on?
They get burnt out. And it's really hard to be a support system for them because you don't have the answer to them being burnt out because of the number of patients that are being put on them. And it's complex, okay? It's not like, oh, we're just going to put all of these exams on these dentists here because we want to. It's staffing.
Mm.
There's only so many people that are going to join the military to be a dentist. And a lot of times people are going to come in to join the military to be a dentist so they can get out when their school is paid for. So it's a
Is that the
short.
motivation? Because right
Yes.
when you said that, I was like, okay, so why would someone choose to work in the military if the schedule's that demanding?
Yes, it's definitely the motivation. But I think aside from that as well, there's a motivation for people to take care of soldiers.
I'm sure. Yeah.
Yeah, they want to be in that environment. They want to take care of the people that are taking care of us, the people that they call on to go to war for the country as needed or
Yeah.
to do whatever they need to do to help keep our country going. So that's definitely a huge motivation for it too.
So it's interesting because it seems like if I think of parallels, I guess, between military dentistry and then
Hmm.
private practice, a lot of the motivation is production. But in the military, it seems like it's more battle readiness, but kind of same pressures, just in a
Yes.
different way.
Yes, I think so. Yes.
So, with that, like with all those exams that they're doing and having to kind of just push people through, is this where you have seen maybe people seeing a Prophy Tech that should be seeing a hygienist?
Yes. That's where the disconnect happens for doing proper diagnostics and getting those soldiers to the person who can provide them the level of care that they need. And I was normally in a position where I was working in a bay where there was several chairs. So there would be doctors, there would be myself, a hygienist, and then maybe across from me so that we can work as a team, there would be an X2 for Prophy Tech. So I'd be working on my patient or closing out a note or just doing my job. And then I see somebody standing there at the end of my operatory with their hands kind of crossed. I'd be like, oh, hey, what's up? What's going on? How can I help you? What do you need? This patient is with me. They have a lot going on. They have a lot of bleeding. They have a lot of calculus. I don't know what to do. Put them on my books. You know what I mean? Put them on my
Yeah.
books. Go get the doctor, talk to him about, what's going on, and then put the patient on my books. Or, put the patient on my books and I can talk to the doctor for you. But I would see that more frequently than I would like to, I don't want to see it at all. So
Right.
I would see it pretty frequently.
And would you have experiences where you have someone in your chair that maybe you hadn't seen before and they had maybe been seeing a Prophy Tech and then you get in there and it's like, wow, there's a lot going on
Absolutely.
here.
Absolutely. And then the thing that resonated with me the most when I was working on patients at that time in the military setting, okay, so we have time during the week in the clinic that I was at where we would have to do what's called chair maintenance.
Hmm.
So, chair maintenance is going to be basically like the sanitation and sterilization part and keeping the clinic running, making sure the chairs in clinic is functioning so that we don't have a clinic that's not functioning. So, we would have time to, run the lines, change the trap out, make sure everything's working properly, catch up on what we need to prepare for patient care for the next week. And then during that time, one of the things I would do, of course, is scrub my charts. So I would scrub my charts. I would look at x-rays from the most recent exam and then all of the other exams that they would have for each patient that I was going to have for that week. And then I would look at the clinical notes for hygiene specifically. So I started seeing like, okay, this person was a hygienist, this person was a Prophy Tech, this is how many times they saw a Prophy Tech. And then they would get in my chair and they would have crazy bone loss, especially in their anteriors, in their
Hmm.
lower anteriors, because they're not allowed to go subgingival and they don't have the skill set for it. And the patient maybe has good home care, but maybe not great flossing. So they have super tenacious calc that's just kind of sitting there under the gum line in the lower anteriors. And then I go in there with the scaler and there's a nice little volcano. And then I'm probing and I'm like, whoa, that's a lot of bone loss. This is not a prophy. But because of the way the patient presented, they think it was.
And would you say, so I honestly, I have a lot of sympathy for Prophy Techs as you're describing it because they're just
Yes,
not really given the tools, right? And I
they're
just
not.
wonder, do they know? Because sometimes you don't know what you don't know, right?
They
And
they
so
don't.
do, do they even know that these patients are advanced perio?
No, no. For the
Okay.
most part, no. Some of them do. Okay, so as far as the X2 school in the military, so when the soldier goes to that school, it's something that they're doing for the advancement of their career so that they can get promoted later on. So in dental, it's going to work. You come in, you're a dental assistant, and then eventually they want you to make enough rank to run a dental clinic on the military side of things and be in charge of soldiers. So there will be a practice manager for the civilians and then a soldier of higher rank in charge of the soldiers. So in order for them to get enough of what's called points to be promoted, they have to participate in certain things in order to get points. And X2 Prophy Tech School is one of those things.
Hmm.
So, not all Prophy Techs want to be doing that job in the military. But in order for them to get promoted for their career's sake, they go through that school. So, they don't want to be there and they're providing that patient care. And then on the flip side, you have some that really enjoy dental and they want to be a hygienist when they get out of the military and they're learning on their own and they have a lot of realizations that are like, oh, hey, can I ask you about this? They'll ask a hygienist, be like,
Hmm.
hey, what's going on here? Can you tell me a little bit about this? What's going on? Tell me about your patient. What was your patient like today? So they're very interested in learning and very interested in growing their skill set. But so both ways with that too.
Yeah, so some it's just kind of a means to an end, right? And then
Yes.
others really are excited about teeth.
Yes. And then also, sometimes people are not gonna stay in the military, or,
Mm.
like a lot of times they're not gonna stay in and retire out of the military. So they're just kind of going through the process, serving their country, doing their thing in whatever job was available, and then they're out of there. So it's not something that they're interested in.
Yeah. Yeah.
Mhm.
So what, I guess with your experience seeing all of this, what are some risks with a program like the Prophy Tech?
Patients not getting the kind of care that they need in order to stay healthy overall.
Yeah.
And patients, like when I heard about the bill for OPA, and it stands for Oral Preventive Assistant,
Hmm.
one of my thoughts was I already knew where the model came from immediately when I heard
Yeah.
that. And then I also thought to myself, OPA, Oral Preventive Assistant, what exactly are they going to be able to prevent with that training because they don't know what they don't know, and the risks that I've seen is just patients who have not had the proper care over long term because they've seen different people over the years. The process is rushed because of the pressure to get these patients in readiness on the dentist side and the hygiene side and every side. and they have festering periodontal disease over years, and then they're getting out of the military. And then, I had caught a few people over the years where they're getting out, and I give my patients tons of information every time I see them, and especially in this setting because I'll never know. I don't know if I'll ever see them again.
Yeah.
And I'll go, hey, this is what you need to do for your oral health to keep yourself in the healthiest state possible, blah, blah, blah. And then they'll tell me, this is the most thorough dental appointment I've ever had in my life, and I've been in the military for 20 years.
Wow.
So there's a gap in care there. They're not able to provide the information for the patient to actually be preventive in nature, So that's the highest risk, I think.
Yeah, and I just it reminds me of this experience I had at one of my old practices a long time ago. One of the assistants was there, and I used to be a complete, well, I am still kind of, but I used to be a freak about OSHA and like cross contamination and infection control. A
Mm,
lot of hygienists I think can attest to that. But she was an assistant who didn't go through any kind of formal training. She was trained on the job, and she thought, when I was talking about this stuff, that I was being extra and that, it was silly. And she would like literally laugh at me. Well, and I knew, I was like, she doesn't know. She doesn't know what she doesn't know.
yes.
She actually went to hygiene school. And when she got done with hygiene school, she reached out to me and she was like, I am so sorry that I had no idea. And that's kind of what I'm talking about is like, people just don't know what they don't know yet.
Yes, and then on top of that, the person who's trying to fill the gap for patient care and they get assigned these responsibilities, or they're going to be working in a private practice, and the doctor's going to go, hey, we need you to do this because we don't have a hygienist here to do this. So go ahead and do it. So they'll provide patient care for a number of years, but you also know who else doesn't know what they don't know? The patient.
Hmm.
The patient. And that's heartbreaking. That's
And
heartbreaking.
ultimately, they're the ones that are going
They pay for
to
it.
be suffering because of this, right?
They suffer the
Yeah.
consequences.
Yeah. Well, what about, I don't want to like be a Debbie Downer this whole time, but
Yeah.
what are some advantages of the Prophy Tech program that you've seen?
When they are able to practice in their scope and help fill that need, that is very rewarding for them. Yeah. And when they're able to learn things, and this is hard. This is hard.
It's okay.
They're such good people all over the country, in the military, outside of the military. But the benefits of having them there when they're able to truly practice in their skill set and learn, that's a really good advantage because of the interactions that they have in patient care. And it teaches them how to work independently with patients and grow relationships with patients and understand the need for good care for their patient population. So
Yeah.
that's a good thing about,
And
yeah.
yeah, and I just, you know, when I think of like the OPA and just kind of the situation that we're in dentistry, I am torn because I don't want to be someone who's like protecting their turf and doesn't want it to let anyone in and just, hoards this job that we have. And I think in some situations, if the systems were put in place and the training was really good, maybe it could work. Like, I'm probably going to get some hate for that, but
No, I think
we've got a problem right now that we need to solve. But rushing things through and
that's not
just
the
like
solution.
throwing people into jobs that they're not really prepared for, I don't think that's the best way to do it.
I don't think it is either. And, my favorite time that I had working with X2s in the military were ones where they were receptive to learning from me about
Hmm.
the patient's hygiene needs
Yeah.
because that's our scope of practice.
Yeah.
We know what patients need for hygiene. We were trained for it diligently. And
Yeah.
that was a really great time when they would come to me and they knew it was hygiene. So they'd kind of look around and be like, they wouldn't look for a doctor, they would look for me.
Yeah.
You know what I mean? Because they knew.
Y-
And they also knew I would heavily advocate for patients when they had the wrong diagnostics for hygiene with doctors when they had this really heavy schedule. They would see me and they would go, oh, she's going to go tell the doctor. Or they would go, oh, I can't do this. Please help me. Like, the doctor's the one who put this diagnosis here. Like, what do I do? No worries. Let's go talk to him, or I'll go talk to him. So that was really great when they were open and receptive to learning and learning about what hygienists do too.
Yeah.
Yeah, that
You
was
were
an
like
awesome
supporting
time.
them. They're like,
Yes.
okay, she's got her back.
Yes, yes. That was good.
Yeah.
I
Yeah.
think I think OPAs should be trained by hygienists.
I agree. I actually brought that up on a previous podcast that my opinion was not shared, which is fine. But I'm like, if this is going to happen, and I don't think it's if, it's when, I think it's going to happen. Let's set it up so that hygienists are the ones training them. At
Yes.
least we would have some kind of control over the quality of care, right? Or education, I mean.
Yes. So I think if we're going to introduce OPA to help fill the gap for the need for care, that they should be trained by hygienists so that
Mhm.
they have a good skill set to recognize, what they need to be doing in that particular role. And I also think that it should be a requirement that if somebody is going to be on a regular schedule where they're coming in, for a 6-month prophy, that they should have to see a hygienist one time per year. I
Hmm.
think that would be sensible so that we
That's
can
such a good,
help. Oh,
yeah.
go ahead. Sorry.
No, I'm just saying that's a great idea. I love it.
Um, yeah, it's really hard. So one of the things that I would always tell my patients when they were in the chair was that dental is the least accessible form of care in the world. And that would just blow their minds. And I would tell them that not just because they had good home care practices and they were great patients, but the patients who came in didn't know what they didn't know. I would tell them that too and be like, hey, we can learn a lot today. Dental is the least accessible form of care. This is how I
Hmm.
want to help you. So, yeah, it's hard. It's hard for the dentist for sure. I feel for the dentists that don't have the kind of team that they want inside their practice. But I also think that as a set of professionals on the hygiene side, being a dentist, being an assistant, that we have to think really practically about how we're providing care and not rush things. That's
Yeah.
one of the biggest complaints from hygienists and even from patients when they get care that's rushed. It's detrimental to people's health.
Yeah, I agree. There's so much pressure. But
Hmm.
so what other ideas do you have for making like the OPA model successful?
I think that's my biggest concern is like
Yeah.
their training. Like, I think they should be able to be trained by hygienists. I also think that I just don't think you should be able to pull anybody out of somewhere and say, hey, I'm going to train you to do this because they don't have the time to in private practice. I feel like that's almost impossible, like to dedicate that time to them and then to keep a practice running so that it's profitable and good care for the
Yeah.
patients.
I
So,
almost like laughed, or I think I did laugh a little bit when I saw that. I was like, what dentist has time to train
mhm,
someone in between patients here and there to like be a hygienist? Like
mhm.
they barely have time to come in and do our hygiene checks. How are they
Yeah.
going to train someone? It's kind of crazy.
They're running 30 minutes late to do a check.
And I don't think that they
Doing it.
want to do that. Like they didn't go to dental school to like train people to scale teeth. I don't know.
Yeah, yeah.
Yeah. So I do want to talk about earning potential is in
Hmm.
the pay. Is in your experience, is the pay pretty much like the same with private practice or not?
It depends on who you're working for when you're providing care in a military dental setting. So,
Okay.
for civilian hygienist can either work for directly for the US government, getting an application, filling out an application and working in and getting hired through USA jobs. So they can work directly for the government in the military facility or they can work for a contractor. Contractors have more fair, equitable pay than working for the government does. So
Okay.
the government, you know, provides different things that entices people to work for their side. So a retirement pension, less expensive health benefits, more time off. So, but the level of pay for hygienist in a military setting through the government and not a contractor has been extraordinarily low for many, many years. The pay is like, okay, so I'll give you an example. The pay for a hygienist was almost the same as an assistant who was a contractor.
Oh, okay.
Yeah,
But they're getting all of those benefits, which counts for something too.
it does. It counts for
Yeah.
a lot, but their hourly pay was probably sitting somewhere around $28 an hour.
Wow.
26
Okay.
to $28 an hour in comparison to, an assistant of a contracting company making $25 an hour.
Wow. Yeah, that's kind of a tough pill to swallow.
Yes. Yes.
Yeah.
So
But
that was,
contractors may be more in line
yes,
with what they would make in private practice, but not so many benefits.
absolutely. Yeah. I
Okay.
mean, still benefits, but maybe at a higher cost. like their health care was at a way higher cost than you would pay for having health care in the government. And then, oh gosh, yeah. So, yeah, different benefits, but the pay was very low for a long time. They recently had, from what I know of, a big pay increase on in hygiene on the government side. But to my understanding, talking to people who still work in those facilities, I have a lot of friends that I've gained from working in a military setting. They, it's still not comparable to working and being paid by a contractor.
Hmm. What about student loan repayment?
I'm not sure. I'm not
Okay.
sure. Yeah, because when
Okay.
I was working for them, I was not working directly for the government. I was working for a contracting company.
Okay. I just feel like that would probably be a pretty big draw for some people.
Yeah, for sure.
Yeah. And is the scope for hygienists, is it pretty much the same in the military? Like, is there any restrictions or something?
I think it depends on the clinic. I
Okay.
think it depends on who's running the clinic at the time that you're in there. When I was working there, I was able to learn how to do local, trained by, you know, the military, and it was in a state that did not allow hygienists to do local at that time.
Oh, interesting.
Yeah, so that was really cool. And then, I mean, it really just depends on who you're working for and what role they want you to play as the hygienist. But I didn't mind that so much because it just allowed me to have a really good amount of time for the kind of patient care that I wanted to provide for my patients at that time, especially
Would
like
you
with
say
preventive with
that's,
OHI.
oh, yeah, I know. It's like, I've worked in some offices where you have like 2 minutes for OHI, and I think that's one of the most important parts of what we do,
Mm-hmm.
and we just don't have
Mm-hmm.
time to do it.
Yeah.
Yeah. So you mentioned like having that time and having the autonomy to like just get more time if you need it. What are some
Mm-hmm.
other benefits or good things that you've experienced being a hygienist when you worked in the military?
You get to meet people from all over the world.
Yeah.
Oh my gosh, that's the best thing. And you just get to build a relationship with people from everywhere, and it just makes my heart happy to interact with people just being people.
Yeah.
Because in that setting, okay, so this is kind of a weird way to put it, but like in the military, you're not allowed to talk about politics,
Okay.
right? So that's
I'm down with
that's
that rule. I like it.
Right? That's removed from any situation that you ever have in clinic care. So, like in private practice, you can have somebody come in, and what are they going to do? Talk about the most recent political thing going on, right?
Yep.
And you're like, oh, this is exhausting.
Yeah.
That never happened in that clinical setting because they weren't allowed to talk about it. Which I mean, not on like when they're in their professional setting,
Yeah.
like
Yeah.
at home personally or whatever. But that was really refreshing. So I got to experience people just being people, serving their country. Most of the people in the military wanting to be of help in some way. And then I also got to meet people who joined the military to escape situations that they were in.
Hmm.
So I just got exposed to everything and anything,
God.
and that was great.
Yeah. Yeah, that's awesome. And it just gives you such perspective that maybe we don't get in the civilian world, right?
Hmm.
Yeah.
Yeah, and then
What
also
about,
you don't have to push these people to get the care that they need
okay.
because you're not selling them dentistry. So
Yep.
that was amazing too.
Oh, that's awesome. Yeah, when you take money out of the picture, it's good. I know it's not realistic for most times, but yeah, that's
Yeah.
nice. What about some limitations or maybe some downsides that you've seen or had?
I think one of my least favorite things was that they're like, you're a hygienist, don't go into x-ray, which is really weird. But
Hmm.
that's because they have to document everything. Like they're like, okay, this person, how I told you there's like somebody assigned to sterilization specifically to keep
Yeah.
sterilization running. They have an x-ray tech who's specifically assigned to x-ray to keep x-rays running and to keep all the machines in order and to have accountability for that.
Oh, so
So
you can't go in there and take x-rays when you need to?
not really. They have to take it for
Oh,
you. And
okay.
then, of course, like you have to run to the doctor, get something filled out, and be like, hey, this patient needs an x ray. But that was also even if I just needed like post op bite wings.
Oh, geez.
Yeah.
Yeah. It's like a whole thing.
Yeah. So there's certain things where like, no, we really have to do this and be by the book this way. So I'm not really, I guess, I never considered myself a really by the book person for certain things, like
Hmm.
when it comes to common sense. So,
Yeah.
and not to talk down about the military, but they work in a very structured way. So
Yeah.
the structure was a little bit overwhelming for me at sometimes. But
I
there's always a
bet.
way to work around it. It communicates. It's basically just like a trickle of communication. So,
Yeah. Well, before we wrap up, first off, I just want to say thank you for coming on and talking about this. I know that it takes some bravery, to talk about this kind of stuff, so I appreciate it. But
no
if
problem.
anyone's thinking about a career or working for the military, what are some things they should know?
It's just as fast paced as any other place. It's not easy, but it's super rewarding.
Yeah.
And I mean, I don't know. I would say if you've never tried it, give it a whirl. It'll change your perspective.
Yeah.
Yeah.
Awesome. Well, thank you again for your time. I
Yeah, of
hope you have
course.
a good rest of your Sunday. Do you watch football? Are you into that?
Yes,
Okay,
absolutely.
okay. Yeah. Yeah, I know my boyfriend's like, okay, football, it's like 9 hours of football today. I'm like, yeah, I'll be doing something else for most of that.
Yeah.
Okay. Thank you so much for your time today. And thank you everyone for listening. We will see you next time. Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.